The highly infectious disease coronavirus is changing our world. It has caused widespread illness, millions of deaths, and has indirectly caused crippling economic distress and social isolation. Billions of people around the globe have been impacted in one way or another from the virus.
This virus, it spreads quickly, it capitalizes off of inequities and disproportionately affects underserved populations, communities of color, older communities, and the best we can ever hope for is for the curve to be flattened and for it to be kept relatively at bay until we can have better science, more information, a vaccine.
The first case of COVID-19 in the U.S. was confirmed in late January of 2020, and on March 19th, a mandatory stay-at-home order was put into effect for the state of California. Nearly 40 million residents were told to stay in their homes, only leaving for essential trips. City leaders made some major changes to keep Santa Barbara residents safe.
The city pivoted quickly to provide essential services to the community during the COVID pandemic. Our goal was to embrace technology and new creative ways of providing those services such that the public was served in a safe and efficient manner, and yet while ensuring the safety of our employees as well.
People's lives, city policies, and ways of conducting business may never be the same. The city of Santa Barbara and its residents continue to work together to overcome the hardships and challenges presented by the virus.
I think like everyone, early on, we didn't really know what we were dealing with. And then as more healthcare professionals came out and county public health, and again, our partners in the emergency rooms and with the fire department, it became very clear that this was dangerous, that we needed to do the right things. And as soon as the stay-at-home orders came out from the governor, that really changed everything for us. In a matter of 2 hours, it went from what are we going to do to now we really need to implement something.
There was a lot of orders coming in, a lot of new information coming in. It's important for us to go through them, to understand them well, and to properly advise all the different departments about them. And then also to disseminate the information to the public.
The city initiated a number of public information campaigns to educate the citizens, businesses as to the safe, healthy protocols to both engaging in public, principally wearing masks, social distancing, washing hands. We were getting the directions from both the state public health officer as well as our county health officer. The city doesn't have a public health function, and so we were really conveying on those directives, those guidelines as they were established by those higher governmental institutions.
Not only in our department, but citywide, our priorities were safety. I mean, at a city level and a national level early on, we weren't necessarily getting a lot of information about how this thing really worked and how it spread. And so we were kind of overcompensating with a lot of measures out of the gates. So staff safety on our end was a priority. I really wanted to minimize the chance of COVID cases within our work group and minimizing COVID cases for patrons who serve the waterfront. And so safety was the priority.
We listened carefully to the public health experts as we were learning, or they were learning more about this virus, and we took recommended steps for operating our type of facility. And it was an ever-changing environment. Initially, masks were not a requirement, throughout the city, but we were on the leading edge of that because it increased everyone's confidence by having that requirement in place. But we definitely listened very carefully to those public health experts. We monitored what other airports were doing across the nation, and we made our decisions based upon that.
Our change in our procedures and our plans kind of mimicked society in general. If we look back to when this started, we were only supposed to do a 14-day shutdown, and then everything was going to be fine and we'd go back to normal. And we realized after a period of time that it wasn't going to be fine and we weren't going to go back to normal. And this became very quickly our new normal. And our new normal is always to respond quickly and compassionately to people, but the idea of putting that equipment on, the goggles, the jacket, the gloves, and an N95 mask became the norm. And frankly, I don't see that going away anytime soon. I think that's the new way that we conduct business until, on a local, state, and federal level, the pandemic is declared taken care of, which I don't see happening anytime soon. The other thing we did internally in the fire department is that we really limited our contact with people. Normally, our fire stations are open to visitors. Normally, we go out and conduct fire prevention. We go do multi-company drills. We interact with the public, and we had to modify that. We are not doing public education right now. We're not having kids groups come into the fire stations. We're not really doing fire prevention. We've changed the way we're drilling with our firefighters because we're really trying to keep the number of people down and what we call those congregate settings, large numbers of people down, because we know that the larger amount of people for a longer period of time equals exposures.
Certainly in the short term, people have adapted. People are wearing masks, they're maintaining social distancing, people are working from home. Everyone's behaving in a way as though I could be an asymptomatic carrier, because 40% of those who are infected with this virus do not present with symptoms. That's the way the virus is. And I need to have the respect for my colleagues, my brothers, my sisters, my community to recognize that I could be an asymptomatic carrier. So I'm gonna wear a mask, stay socially distanced, try to do as much outdoors as possible instead of indoors to keep people safe.
City employees practice social distancing, wearing masks, sanitizing workspaces, and take other precautions to stay safe while providing essential services.
We really have lengthy safety protocols, and we've all got that documented on our website, the steps that we've taken, but it includes everybody spreading out their workspaces so that people aren't working in areas close to one another, and always wearing the masks inside the building when there's any chance of you being anywhere near anyone else. Hand sanitizer at every station, sanitizing protocols on all surfaces, really trying to limit the number of shared surfaces so that everybody has their own individual workstation.
Of course, as a city, as an employer, the first thing we want to do is ensure the health, welfare, and safety of our employee population and make sure folks have a safe environment to work in. So we had to kind of develop policies to ensure that safety, but we also had to maintain and look at whatever our legal requirements were. The Families First Coronavirus Response Act came out, and so we were obligated to look at that law, make sure we implemented that law, and make sure our employees were covered by that to ensure that folks, God forbid they get sick, but they had those protections of sick leave and any leave that they needed in the event they got sick. Some of the concerns that were bubbling up in the employee population, folks have kids and they're being impacted severely by the stay-at-home orders, by schools being closed. And for our employees who have children, it was really necessary to take the temperature of what their needs were. So we sent out an employee survey to those who required some type of childcare, to those who had kids. And based on those responses, Parks and Recreation went ahead and developed a really comprehensive plan for folks who had kids that could partake of their programs. So we tried to meet those needs because we know, as people in general, not so much as employees, our families come first.
So our park rangers, as well as our park operations staff, all of their work schedules were adjusted. So we focused their work schedules on the weekends. And similarly, our beach lifeguard staff, we brought them in a month earlier than we usually do, because we were finding once kids were done with their distance learning at home and it was the weekend, people were going to the parks and people were going to the beaches, and we needed to make sure we had the staff, including our park rangers, doing education, helping us with signage, and then also the staff to monitor activities to ensure safety.
From a staffing point of view, we acted pretty quickly. So we closed our front office. Typically there's a lot of foot traffic in and out of our front office, paying slip fees, buying parking permits. It really is a small area, and so minimizing that amount of foot traffic in that area was really important. We implemented flexible schedules, so staff that could telecommute did. Other staff, such as our maintenance, obviously couldn't telecommute. We separated work groups so that there was limited overlap between those staff members.
Facilitating employees working from home was a key strategy for slowing the spread of the virus, and the IT department spent a lot of time working behind the scenes, strengthening the infrastructure to allow employees to efficiently continue their work.
We had two priorities. One was getting our workforce working remotely. So we did a number of things. One was buying a whole bunch of laptops and deploying them to the workforce. Two really complex things like doing extensive troubleshooting and really a major rebuild of our virtual private network system. We bought a whole lot of peripheral equipment like cameras and headsets and all those things that people need to get going. And then the last thing internally was, again, we looked at actions we could take to minimize person-to-person contact. So we invested a lot of time and resources into electronic documentation, like something called Seamless Docs, which is similar to DocuSign. So we could route contracts, take in web forms and all sorts of things on a remote basis, but still provide service to the city. The second priority was still making ourselves available to the public, but again, remotely. So the other part of our priority was out-facing service. And so to that end, we contracted with LogMeIn, and we purchased dozens and dozens and dozens of licenses from them for GoToMeeting and GoToWebinar. But then we enlisted a whole lot of people in the city and had to train them on how to conduct remote public meetings, council subcommittee meetings, and all of our advisory boards.
Because of the pandemic, we couldn't have meetings like before, which are in essence big gatherings of people. So they had to find a solution to that and comply with the open meeting laws, the Brown Act. So they were able to find a way through YouTube, through TV, through ways where people can call in or click on a link to join a meeting so that they can be heard, that the council members can be heard. And also, in the middle of the pandemic, the governor issued an emergency order that kind of lessened some of the restrictions. Arroyo, the city attorney, had to go work with the department, let the city council know what the rules are and make sure that we comply with those rules. And that's why you have these council meetings on television, online, very accessible. People can call in, people can log on from the computer and give comments. So it was a challenge, but Arroyo, the city council, and the departments were able to work together and find a solution to keep those meetings going and find a way for the community to continue to interact.
It's been interesting. It's a different forum, and we've had some challenges. For example, we like to have the public comments available for people to be able to see, and normally we would do that in paper form in the meeting, and people at the meeting would be able to see what others had said. That's something that was a little bit of a challenge that we had to figure out how to overcome, and we are still actually working to get that piece of the process modified to accommodate the virtual meetings. But generally speaking, I think it's a good format. It allows people to participate without having to be in person or travel, and all of those are important to protecting our community.
In addition to conducting public meetings online, the city decided to try and conduct other business online as well. Community development took full advantage of the online platform and the brand new program, Acela.
So we had a twofold goal. One was to make sure that we were keeping our staff safe and the community safe. And the second was to make sure that we were able to continue our operations to serve our customers in the best possible way with as little interruption as possible. We started out with having people drop off and pick up plans from the lobby outside the David Gebhard room. So we were able to secure the door so people could come into the lobby, drop off plans without having any staff in that area. But we very quickly moved to online submittal and digital management of our plans using our Acela platform, which is a new platform. We had planned to go there probably in a couple of years, didn't expect to go there in a couple of months. And That continues to be evolving, and we're all learning that, including our customers, but it has allowed us to have some efficiencies in the management of those plans, particularly that now that we're looking at digital plans rather than having to have one set of plans that go sequentially through a number of steps, people can look at them simultaneously, and so it allows us some efficiencies in that process.
The Public Works Department also began conducting much of their business online.
One thing that we also decided really early on was that it was important for projects that were funded to continue to move those projects along, that it was important to show the community that not everything would come to a halt. So we have certain key capital projects that were grant funded, and we wanted to move those forward. So what we normally would have done with a new project, a groundbreaking in the beginning of the project or a ribbon cutting at the end of a project, and those were typically celebrations where we would invite the community to come and participate in those things. And rather than just pull that back and not do that, we shifted to virtual versions of ribbon cuttings, and we even did a virtual groundbreaking for the MODOC Las Positas multi-use pathway. And I believe it was actually very successful, and we've learned in doing some of those things that there may be some efficiencies to doing that in the future post-pandemic.
Submitting digital plans and holding virtual ribbon cuttings are new ways the city is conducting business, and many of these new business practices are likely here to stay, even after the pandemic.
I don't think that our business will ever be the same. I think that we will need to continue to find ways to serve our public and the visitors to Santa Barbara in ways that we wouldn't have ever imagined. But now it's going to be more of a normal course of business. And there's a couple really simple but discrete examples that staff will be working on in the coming future. For example, rolling out credit card payments a little bit more broadly to not have to require either cash or check payment, just to avoid and sort of minimize the hand-holding, and then more online payment and functions, both submitting documents, applications, payment, just ways to interact with the city in an online way that is suitable and transparent and safe, both for English speakers and also multiple languages as well.
It was very important that I myself got out there and traveled a bit during this early period so that I understood exactly what was required in this new era, particularly if I was going to be out front ensuring our community and our passengers that it was safe to travel by air. I needed to have experienced it myself so that I could encourage people to do so with confidence. And I learned that here in Santa Barbara, we're really on the leading edge. We were doing things that some airports weren't doing out there, but eventually every airport came around. So it really, assured me that we had taken the right steps early on, and that listening to the experts and how we manage our facility and care for our employees and our passengers is critically important.
When the state of California made the difficult public health decision by limiting and closing some businesses, it had a ripple effect. People lost their jobs, and in consequence, some could not pay their rents.
COVID-19 brought about some major economic challenges to the community, and the council wanted to protect both residential and commercial tenants, so they enacted the emergency temporary eviction moratorium ordinance. Arroyo, the city attorney, and other lawyers in the city helped work with the city council to support them and to work for them, to provide them with an ordinance that they want to pass, and it was passed. Then our office's job was to educate people about the ordinance, enforce it if necessary, and also provide technical support. The office created a hotline for people to call in to answer questions about this emergency eviction moratorium ordinance. And we fielded questions. We talked to both tenants and residents from both commercial and residential properties that had questions about our ordinance, and so they know what the parameters are and what the protections entail. And then there's other emergency orders as well, including face covering orders and orders that created the State Street pedestrian promenade, which allowed for a lot of the businesses to set up outdoors and on the street so that they can have more capacity to cater to their customers.
The fear of a down-spiraling economy and mass unemployment made reopening businesses critical, so the city laid out strict guidelines for businesses to open under. It not only protected public health, but the health of employees of local businesses as well.
That original recommendation to allow outdoor business activity ultimately came forward to council in the form of a recommendation to establish an emergency economic recovery ordinance. And the idea of the emergency was that it went into effect immediately upon their approval, the suspension of rules and regulations to allow businesses to operate outdoors, principally outdoor dining, but over time we saw other businesses, personal care businesses, operate outdoors. And then secondly, the city closed State Street in downtown from Haley up to Sola initially. And one, that was to allow the public to be able to walk and enjoy the downtown environment in a socially distanced manner, not necessarily be restricted to the sidewalks. And then two, that closure of State Street also allowed a very high number of food service businesses to operate.
The State Street closure was a really interesting process that we went through. It was part of an emergency declaration that was approved by council. So with probably only a few days of notice, we made a promise that we could get it closed back, I believe it was in May. State Street was closed to vehicular traffic and it was open for ped and bike use, and it created a lot more room. This was very early on in the pandemic. Mask use was still not yet widely followed, and having that additional space, I think, was really helpful for the community. What we've seen since then has been this evolution now of that space becoming more and more used by the adjacent businesses, primarily the restaurants, maintaining a space in the middle for the continued use of pedestrians and bicycles. But what we have out there now are a lot of parklets up and down State Street on both sides, and that is allowing customers to be able to be outside, which the more and more that we learn about this virus, we're learning that being outside is much, much safer than being indoors.
The swift, decisive reaction to the COVID-19 pandemic here in Santa Barbara has likely saved lives and has kept COVID numbers lower than some of our neighboring communities, which is something our community can be proud of. But it's up to each of us to take actions that keep us heading in the right direction.
There are no heroes in public health. No one swoops down with a cape and spandex and saves the day. The way we get through this is we all follow the science, we all change our behavior, and we all think about the health of me and of us, whoever's next to me. Because in the world of public health, we're only as healthy as the person next to us. And I think one of the worst kept secrets with the fire department, with the police department, is that we are all absolutely committed to the health and safety of the community we serve, which is the good people of Santa Barbara, and each other, which is what has really kept our firefighters, our law enforcement officers, our city employees, and most importantly, our community safe.
Just seeing how everybody kind of came together and how quickly they were on board with making changes and making adjustments to how we did business. Nobody was overly set in their ways, and everybody kind of understood the gravity of the situation and was really kind of up for just changing the way we do things and still serving the community. So the ability to see staff kind of happily adjust and do what we do on a day-to-day basis, it was awesome and great to see.
I'm proud of the fact that we're able to find solutions to very difficult problems in this kind of unprecedented time that we're in because of the pandemic, and the fact that a lot of things were new.
It's such a team effort, and I think a lot of times people might not see that, but even the community's part of the team. I appreciate the fact that we had community members that were going out of their way to help us, and we would help them. They were helping the fire department. All of the people that went out and did everything they can to show their appreciation to the healthcare professionals, all the unsung heroes the people that help their neighbors, the people that check in with people, the people that helped animals. I mean, this is truly a team effort. It's a community-wide, and the police department is here to make sure everybody else is safe, but I really appreciate all the things that the community did.
I think as a whole, our response to COVID was comprehensive. It was very responsive, and it was really fast. And I think we're still learning things. Things change every day. Every day there's something new that we need to respond to or look at, or a different nuance of interpretation occurs. So we are trying to be fast on our feet and pay attention to all the little things that happen and respond appropriately.